Welcome back to Not Alone, where this is a place where we share stories. I'm a truth seeker, and where it provides you hope and direction to advocate for your own health. This is why I have the honor to have health experts on to share their knowledge. And I'm often asked, why is this not out there for everyone to know? And there's a big why to that, and we'll dive into that a little bit more. But today I have Dr. David Porter, all the way from Wyoming. And gosh, I cannot say enough about his book, AIME. It's a very easy book to read. AIME is called Airway, Infections, and Metal. Dr. David Porter is a biological dentist, and it says a pathway to wellness for the prevention of chronic disease, which has been such on the rise for over decades now. And I truly believe the root cause is often found in the mouth. And his book, I'm going to recommend it to everyone. I just bought tons of other copies because I'm going to be gifting it to everybody. If you're not a reader, it's less than 100 pages. It simplifies the airway infections and as to why this is not status quo. Why are not all practitioners treating this way? So I absolutely loved, I highlighted so much, took so many notes, and I'd love to just welcome you on and thank you for your time.
Well, thank you for having me. It's a pleasure to be here today.
Yeah, thank you. I loved the way you started your book. It was just a love for the profession, for the providers. And this is where you're not trying to cause any blame to anyone else the way they're practicing, but also you said dentistry requires more precision than neurosurgery. So I always say that too. It takes so much precision and perfectionism and concentration that they are truly very gifted, very bright. But you do say that what they learn in dental school limits their knowledge. And I just wanted to read a little bit. I love that you said the standard is simply far too low, but you can't say enough good things about the people in the industry. We have a long way to go regarding the health and aspect of people we serve. We were not taught how teeth and the mouth are intertwined with the rest of the body. So I'm just curious as to what got you so curious to intertwine learning all aspects of the body. I know you dive into how your journey started, but for the audience purpose here, how did you fall into biological dentistry? What are some of the things you were not taught in dental school that you had to learn all yourself along the way?
Well, I've pretty much had to relearn everything. There's nothing that I do currently in my practice today that I did the same way when I got out of dental school almost 20 years ago. So everything has been completely redone. And so I wouldn't say that I was taught the wrong way. I was taught the way that pretty much every traditional dentist is taught, and I was taught by wonderful people with certainly good intentions, but it was what they knew how to do. And so my journey really started from just getting out of dental school, and then just really, I would say by the grace of God, being connected with certain people that had a passion for dentistry, and then that continued to stay curious about things. And so my passion has just really always been the truth. And so I seek the truth wherever that's going to lead me to. That's where I want to go. And so, when you get out of dental school, you have a set of beliefs, and then somebody tells you something just crazy, insane of like, do you know that really mercury fillings are not good for you? And of course, you heard in dental school that they were just fine and there's no problem, and that everybody who believes that mercury is bad for you is, selling you, snake oil or whatever. And you're like, what?
Truly.
Yes. And you look at this person that's telling you this, and you're like, well, this seems like a reputable person. They have high integrity. I believe in that they believe this. So maybe I should take the time and not believe something wholeheartedly just because they're telling me it, like I did in dental school. But maybe I should start doing some research on my own because they seem like a very reasonable person. So if a very reasonable person tells me something, I'm going to I'm going to at least do some more research on it and try to find out for myself of like, was that a reasonable thought or a reasonable assumption, or do I just disagree with them? So it just continues, and then you learn something. You're like, oh, okay. Although it seems crazy now to think that, okay, mercury, although we know it is the most toxic non-radioactive substance on the entire planet, okay, we know that, and the Food and Drug Administration, not that I take health advice from the FDA typically, although I think they're going in the right direction. um, I don't normally take health advice from them. They've issued a report on their own website in 2019 talking about the toxic effects of mercury fillings. And we know in Europe they're banned in any man, woman, and child. You cannot place mercury fillings anymore, although they're still the standard of care in the United States. And so when you learn these things and you come to the realization of like, wow, this is just really terrible for the human body, then it makes you start to question other things, and then you just get into this repeated cycle of continuing to question what you do, why you're doing it, and you're just always seeking for improvement. And I think that that's just been the continual ladder I've been on, is to always question certainly what I'm learning and what I'm doing,
And
and
who's
and
funding the learning, right?
well, yeah, well, for sure,
Who's funding
absolutely,
the learning?
absolutely,
Because
yes,
you say this in your book,
yes,
pharmaceutical companies are
yes,
funding medical school. So be aware of that. What are they going to
yes.
try and push, right?
Yeah, I think that they just came out just recently, the New England Journal of Medicine. I think the lead editor or somebody in charge there has just kind of made public that I think 50% of the research that they published in the New England Journal of Medicine is it can't be substantiated, can't be backed up with any, like, the labs that where research has been done has they don't exist. The researchers that put out the research are not alive. And so a lot of the research that they've even publicized has been inaccurate. And so, like you said, I think you certainly, just because you're reading a study coming from somebody, I think that certainly, the New England Journal of Medicine, one of the most highly accredited journals in the world, up to this point at least. I think you certainly have to give it some credence when you're reading it, but you have to be certainly very careful of just believing something hook, line, and sinker just because you read it one time or hear about it in one thing. So that's the balancing act in medicine. Is I always try to go, does this make sense? Okay, that's the first thing, and then trying to, like, okay, read something and then verifying it to prove to myself, or that okay, this is valid.
To apply it in your practice, right? Because once you
Right.
see the truth, I'm sure you had some patients that have mercury in their mouth, right?
Yeah,
They
yeah.
have the amalgam fillings and they have a list of symptoms. And the moment you remove this, you saw that they get better. Like, I
Yes,
mean, I'd love for you now, once you see that, you can't unsee the truth.
that's right.
You're so grounded. Yes. So even you could be mocked. I'm sure I'm still being mocked for talking about mercury poisoning. I'm 100% positive my husband had mercury
Oh,
poisoning.
oh. Yeah.
100% from the nerve damage, from all the symptoms. Now it all makes sense. There was a lot of other multifaceted for his mental health, but the neurotoxin, yes, because that's all he removed for years and years and years
Right,
in his
yeah.
practice. And now, uh, I love for you to shine the light as to what are some of these symptoms of somebody with metal in the mouth. Because, of course, a lot of these could be, they'll go see a practitioner and they could say, well, this is maybe because of this or that. And it rarely comes back to the metal in the mouth. And in fact, I went to do a CE course in Texas for oral cancer.
Oh,
And some of this, a very elite oral surgeon was providing the course. And every picture that he showed of a gentleman with severe oral cancer, there was metal in the mouth.
yeah.
But never did he point that out, how that probably contributed I love how you dive into that in your book, and you probably do a better job than explaining about how the metal in the mouth will affect your acid. Your acid
Yes.
in your gut. And so I'd love for you to kind of describe that because you simplified it for people to understand why metal in the mouth today is so toxic.
Yeah. So all metals corrode. Corrosion, if we want to just be simple, all metals corrode. Corrosion leads to inflammation. Inflammation leads to disease. Okay, so we can talk about mercury, and I think most everybody is going to say mercury is not good for you and toxic. But we're even talking about titanium implants. Again, going back to the Food and Drug Administration, they issued another report in 2019 about talking about the biologic effects of titanium implants. Now, I think 98% of dental implants that are placed in the United States are titanium. Titanium corrodes, it's a metal, and that can lead to significant health problems. Now, that doesn't mean that health problems are going to exist in every single person that a titanium implant gets put in. I look at a lot of these things. My goal in my practice is just to really be a vessel of information for patients. I want to make sure that when the patient comes in, that they leave well informed. My goal is not to steer them in any specific direction. I believe wholeheartedly in medical freedom. And for somebody to have freedom, I believe that they have to have the information first so that they can make a choice. It'd be the same thing as if a patient came in and they decided to start smoking the day after they saw me. I certainly would not be encouraging them to start smoking at all because we know all the health effects. But because they know the risks associated with smoking, they know that it's not good for them. They know the risks that they're taking. I'm okay because we live in the United States of America, the greatest country in the world. I'm okay that they do that. They have freedom of choice to be able to do that because they live in our country. So the issue that I have with titanium or root canals or any of these things is not because people choose them. The issue I have with them is people aren't informed of the potential side effects. And everybody's going to experience side effects differently than the other person. But I think that we have to come to some standard of what is optimal health? What does that look like? And then we can deviate from there of like, somebody may choose to go to McDonald's and eat for lunch. Well, we could probably all agree that that is not optimal health, but I agree that they should still have the choice to be able to go and eat lunch there if they choose to. So I just try to be, as I said before, a vessel of information. And when we're talking about these metals, again, metals have always been detrimental to our health, but the environment that we live in today is dramatically different than it was 50 or 100 years ago. We've got Wi-Fi everywhere, electromagnetic frequency everywhere. You talk on your cell phone, the first thing that is going to ping off of is some type of metal in your oral cavity. And so what this does is it just speeds up the corrosion process. And again, we know that corrosion leads to inflammation. Inflammation is the root cause of all disease. That is the simplest way that we could place it, I think.
Yes. Yeah. No, it is simple to understand that even in your book, you talk about, yeah, over 50 years ago, we didn't have all these towers. Actually, you even had a link to check how many towers you have around. I
Yeah.
actually checked it.
Oh,
I think there was like 178 surrounding my house
yeah.
towers.
And
So,
growing.
and grow. Yes. Actually,
Yes.
they were just putting these wire things underground for this other, cell tower. I was like, wow. So I'm all about using my podcast to have as many biological dentists that could talk about this, realizing what it impacts your health. That's why I have this podcast. The more I have many biological dentists speaking of these topics in their own way, like you said, it could be confusing the kind of information you have. But if you see a consistency of
Yeah.
dentists talking about these case scenarios that they're seeing and giving you the knowledge, now you are prepared to ask better questions for your provider. And you can
Yeah.
also advocate for your own health, going, yeah, you know what? I've been more fatigued. I have a lot more inflammation. I have now, been diagnosed with diabetes or, a long line of other illness from MS. You talked about MS.
Yeah.
I love actually that story of the gentleman. Do you mind sharing that? He was in a wheelchair. and just taking out the metal in his mouth. And then he was able to walk after, and he was
Yeah.
okay.
I mean, it's just really amazing the what you would think is the simplest thing of just like removing the metal. We see things like that, I mean, really all the time. And that really is what inspires me to continue to practice and continue to work hard and continue to educate myself and to continue to seek the truth. Is you just see these amazing transformations from people of something that you would have never dreamed, or I would have never dreamed 20 years ago was even possible. I got into dentistry just thinking that I was just a dentist, and I graduated dental school thinking I was just a dentist. And as I've went down my journey to health, I've realized that really health starts in your mouth.
Yes,
It
yes, that's my
starts
big
there
why, is
and
start there.
yes, you have to start there and then expand out.
Mhm.
A colleague of mine, Dr. Jerry Tennant, he's out of Texas. He's an integrative health practitioner and another brilliant man. He kind of says in his book that he will not even see patients because unless they've seen a qualified biologic dentist first,
Wow.
because what he's witnessed in his practice, he's all dentistry's 70% of your health. If you get that part right, he's all I can get the other 30% corrected. But
So true.
if you don't get the oral health fixed, he's all you'll just be in a cycle of going over fixing things and then refixing things and then refixing things because nothing will hold or stay long term unless the oral health is taken care of.
I see this all the time. I
Yeah.
see this all the time with even cancer,
Yes.
with it's like, go it's the last place they go look
Yes,
and
exactly.
treat. But then they're
Yes.
spiraling or in remission, and it's coming back. And I'm like, yes, this is my big why. Start looking at the dentist. And you also have the background as a naturopathic physician.
Yeah.
So you're able to blend both. But I love that you work with that other practitioner. But you also, what I love, what is the certification as well about reversing Alzheimer's?
Yes. Yeah.
Right? But the certification is a Recode 2.0,
Yes.
correct? It
Correct.
says you're one of the only few dentists certified in that for dental professionals, which is in a program that has a great success with reversing and preventing the effects of Alzheimer's. Now, can you explain that? Because you obviously see it in the mouth, how
Yeah.
it's so connected to Alzheimer's.
Yeah. So the brief synopsis of the Recode protocol. Dr. Dale Bredesen has written a book on this. I actually know Dr. Bredesen called The End to Alzheimer's. And his short version of the story is that basically he's been studying this disease for 20 plus years of his career, probably longer than that. And he came to one conclusion, that of all the drugs that there are, over 200 drugs out there for Alzheimer's, all of them have one unique thing in common: they don't work. So he's just like, I have to recalibrate a solution to this. So he came up with this Recode protocol that obviously there's a health side of things of like you have to eat a diet that's going to be advantageous to health, like a keto flex or ketogenic diet that is going to be advantageous to health. And then there's a dental side to it. And that dental side is you have to remove the infections out of your mouth. You have to get good quality of sleep, and you have to get rid of toxic materials. So it just fell in line with what we do, exactly what we do. So it
Yeah,
was
because you
just
do airway, infections, and
yes,
metals, right?
yes,
That's your
yeah,
book, AIME.
yes.
So those
That's my
three
book.
things.
So
Mhm.
it just aligned with us perfectly, and so it just made obviously sense to align our efforts with his. And yeah, I mean, you can look that up as well too. He's had amazing success stories of people reversing the effects of Alzheimer's with zero drugs. Zero drugs.
Wow.
Alzheimer's is a lifestyle slash environmental problem. Yes, there are genetic components to it, just like everything, but the environment or the lifestyle is really what turns on or off the switch to lead you down a path in that direction, and we do have a lot of control over that.
Yeah, I believe that. I go to a lot of health conferences, and there's definitely a lot of studies and doctors talking about, yeah, it's a lifestyle, the gut health, and then of course the oral health. I'm also seeing that a lot. I had Dr. Karande who worked 5 years in a mental health institute, and how he did see that himself in the
Yeah.
mouth. It affected their mental health. So it's important for people to understand that and have the knowledge. Start looking in the mouth first with a knowledgeable biological dentist, of course. And I always, patients ask me, so what if patients are looking, seeking this kind of treatments now, what are some questions they can ask their dentist, or as they're calling around dental office, because not every biological dentist is created equal.
Yeah.
Marissa flew from Arizona to come see you in Wyoming, right?
Yeah.
Because
Right.
it's really hard to find someone that does the work like you do and has the knowledge and the
Yeah.
expertise. So I would do the same, is fly fly anywhere for the expert. When it comes to your health, it's number one.
Right.
If I don't have my health, I can't take care of my children.
You're exactly right.
I can't go out and make money. So it's kind of like, okay, that should be number one. And also number one is to look at your mouth. And
Yes.
that should be, I'm all about preventative health. That's why I got into dental hygiene. I've always been interested. My other career would have been naturopath.
Yeah.
And so it just aligns so much. I'm a truth seeker as well. After my husband passed by suicide, I asked a lot of questions as to
Yeah.
why that happened to one of the most incredibly smart human being, and caring and loving. And so it just, I'm a truth seeker too. And I love that that's what you're teaching, and that's what you're giving out with this book. And yeah, I'd love to, how can you educate patients to ask the right question and not be afraid to ask the dentist questions?
Yeah, I think you have to be your own best advocate in your health journey, period. And so if your doctor, your dentist, your healthcare provider is offended by any question that you ask because they just are taking offense to it, then I think that that's generally a good clue that maybe you're not in the right environment. So you should have the freedom and comfortability to ask any question. I mean, a lot of these things are very personal to people. Health issues are very personal, generally speaking, and so you want to make sure that your values and your perspective aligns with your healthcare provider. So you have to feel comfortable really asking them anything. It's kind of like a part of the family. And
Yes.
so that's the first thing is that do your values align with theirs? And I think if it does, that's a great starting point to building a relationship. And so you have to be comfortable doing that, and then you can start asking kind of maybe the harder questions of like, why do you do it this way? Have you heard of this? What's your view of this?
Mhm.
And again, because their values or their perspective doesn't align with yours doesn't make them a bad person or you a bad person. It just means that your paths were not meant to cross in this way at this point in time, and that's why it's important to do research. It's really important. We do in our office. We have basically our first visit is called a records appointment, where we just really gather information on the patient. And then the second visit is we have a consultation that lasts typically about an hour or an hour and a half long, where I'm just sitting in there one on one and my treatment coordinator's there, and we're just visiting with the patient about basically everything that we have found out.
Wow. See, you don't
I,
see that very often. I know I still tempt to give an hour and a half of your time one on one. That's one thing that I put on the list of questions I
oh,
send people, is like, how much time are you going to be given with the dentist to ask questions, to go over, your health history and
yeah.
your treatment plan. So that's incredible that you do that.
Yeah, and I do that so I can get a feel from the patient. I want to make sure that the patient feels comfortable and is a good fit for what we're doing as much as they are for us, as I am for them. And so I do that for their benefit, certainly, and for our benefit, because I just want to make sure that our values and our beliefs align and that we're a good fit for each other. And so, and if for whatever reason it's not a good fit, well, then, that's okay. I try to tell them of like, generally, I think it's a bad idea to make decisions out of fear.
Mhm.
Rarely is that ever a good thing, but follow your gut. the angel on your shoulder, the heavenly spirit, whatever is leading and guiding you in your decisions, follow that. Because I hear all the
I love
time of
that.
like, I hear every day of like, I knew when I was getting this done by somebody else, I knew that it was wrong. I just knew in my being that it was wrong, but I felt afraid to question or to say
Yes.
something, or, I felt afraid. And so I didn't do that. And so I try to encourage people to like, whatever that is telling you, your being, your spirit, the Holy Ghost, whatever it is, whatever's telling you, listen to that.
Yeah.
Um, in regards to what I'm telling you, or in regards to whatever anybody else is telling you, I haven't experienced a time where that has been wrong for people, and so I try to encourage them to listen to themselves, and
Wow.
and that turns out, I think, to be very beneficial for people.
Wow. And that you instill that and that you trust that, you are such a blessing to your patients, because to trust their intuition, I always tell,
Yes.
I guide people with the Gut God Connection book. That's what I'm saying. Become your own advocate, and learn to decipher if you're making a decision from fear or
Yes.
from God, or God given, right? Because
Yes.
God given way of decisions will be the peace, the joy, the happiness, the vitality, and the fear will get you down that spiral. So how to decipher that is also oftentimes I talk about removing, decluttering the mind, the toxins. And so being aware of these toxins that might declutter your decision making, right?
Yes.
And having a dentist that will spend time. So you're building trust, of course, and because there's a lot of dental anxiety, dental fear
Yes.
coming. So, but that's, it comes to a benefit of you, is what I'm thinking, is you spending that time though also protects you as a provider, because you are instilling trust. And so now when they'll sit in their dental chair, they have complete trust. Their nervous system is more grounded. And because as a healer, you take that on a daily basis. And the way that you are able to provide in a calm manner, the patient is calm, that protects you over time, your own nervous system along the way, because, you're taking care of thousands of patients, and this in the long term protects you. And I'm curious, as a dentist, for your own mental health, to being doing this for over 20 years, how have you been able to do this job? Because it is very extensive. I mean, to be hunch over, really
Yeah.
awkward
Yeah.
positions. 80% of dentists deal with chronic back pain and some sort
Yeah.
of pain. I've had so many that has their necks fused.
Yeah.
How have you been able to avoid that in your own mental state?
Well, I tried to. I think the big thing for me is purpose. If I'm to
Yes.
be completely honest, I find fulfillment in what I do. And when I want to do things that my time here on Earth is defined. We don't know when, but at some point it's going to end. And I'm always seeking to try to do things that will extend beyond me. Whether it be through my family or my children, and through my patients. And so, if I can give somebody peace, or health, or knowledge, these are things that transcend myself. And so those things just bring me a lot of fulfillment and joy, personal. And so and then that's what inspires me to, again, continue to read the next book, or continue to listen to the next podcast, or continue to be involved in the next residency, or, those things just continue to inspire me. And so really, I think that the fulfillment that I get kind of, gives me joy and peace in what I do. And thankfully, my body has been, I try to take care of my body, or I exercise regularly. And certainly, at different points in my career, I've been better at that. And at certain points in my career, I've been worse at that. But I've been blessed genetically, I guess, that I've done pretty well. And certainly as I get older in life, I take those things less for granted than I did when I was younger. And so I'm more mindful of really paying attention to my body and trying to take care of it. And so I can continue to do the thing that really gives me fulfillment and joy in making a difference for people. That's like I
And I
said,
think
that's
that's the key, right? For
yeah,
anybody,
yeah,
the profession, choose a profession. Because I know so many dentists that feel stuck in
yeah.
the career is maybe because their purpose is not, they haven't found it yet
I
in the
think you're right.
industry,
It's
right? In the
a-
industry.
as you said, it's a very demanding work. You're performing surgery on patients by and large for most dentists that are awake. There's no other medical profession that performs surgery on people that are awake. So they're sedated, and again, we do a lot of that in my office, sedation for things, but most dentists do things on patients that are not sedated. And so you're performing surgery on people that are awake. Their nervous system is on high alert. And
Yes.
so the stress that the patient feels, regardless of who you are or how you interpret that bleeds over into you and you take some of that with you.
Oh,
And
yes.
so
It's
it
called,
makes
I talk
that
about it.
makes your nervous system on high alert as well.
But yes, what you're talking about is where I'm trying to explain in a logical mind called mirror neurons. Our nervous system is doing
Oh,
exactly what it's supposed to do when you're in close proximity with someone. It will
yes.
mirror the nervous system in front of you. So, as a provider, physician, anything that you do, right? If you're
Yes.
in close proximity, you're going to take that on. So, how do you protect yourself? And a lot of it is working on each other's nervous system and providing that care. So I think that's important knowledge for dentists to have as well, and the patient as they're going in to
Oh,
get treatments, because if they stay in that state and get a big procedure, that's going to affect their healing as
absolutely.
well.
You cannot heal if you're in sympathetic, right? If you're in fight or flight, your body doesn't have the ability to heal. So I can perform the perfect surgery. I can do everything perfectly. But if you're in a fight or flight state, your body will not heal. So you've got to get
Yeah,
our
so
body
I'm
in.
curious what you do. What do you do for your patients to help them as they're healing? I'm sure maybe you have some pre-op, post-op procedures to help them stabilize in that
Yeah.
parasympathetic.
Yeah. So we have a pre-surgery or pre-op protocol that we follow that follows nutrition, supplementing. We take a full blood panel for every single patient that comes in the office. So we're looking at everything from a nutritional standpoint, looking at their vitamin D,
Ah,
looking at their A1C, looking at their liver enzymes, looking at kidney function. We're looking at everything from A to Z, so that we can prepare them to have the surgery to have a good outcome. And then post surgery, we are doing things like PMF, red light. We've got a biomodulator transducer in the office that is designed to basically reset the autonomic nervous system to get into parasympathetic mode, rest, digest, and heal mode. We're doing IV infusions and those different types of things pre and post surgery. So, and we open up our surgical protocol that involves the red light and the PMF and ozone sauna and all these different things for our patients a month before the surgery and a month after the surgery. They can just
wow.
come in and utilize these facilities because, again, my only interest is in patients healing. Obviously, if I've invested the time and the effort and they've invested the time and the resources into getting something done, I want to make sure that we are doing everything on our part to ensure or to do at least everything that we can possible to make sure that we have a great outcome.
Wow, I that is incredible. Not a lot of people are treating that way, but the way that you see it, I'm a true believer is to set the nervous system before going into a big surgery
Yes.
and post-op as well. Now, of course, cost comes in. So many patients will say, "Well, is
Yeah.
this covered by insurance?" I'm sure you hear that all the time. And does insurance even cover some of the post-op that you do? Red light, PMF, ozone?
Well, we that's included in our it's like if they're getting the dental work done, we're just doing that for them at
Okay.
that's included in the services pre-surgery and post-surgery It's just included. It's just things that we have in our office that I've invested in.
Okay.
I've invested in those things for certainly the health of myself and our team members, but really for our patients to heal. That's my only interest is in the patient's healing. So I want to make sure on our side of things that I've done everything in my power to try to set the patient up to heal properly. And so that's why we say 30 days before surgery and 30 days after the surgery, all these resources in our office are available for you to use whenever you can come in, and so we allow our patients to do that, and it has really made a difference in, obviously our patients healing and feeling comfortable, and just giving the body. I believe inherently that if the body is in the right state, emotional, physical, and spiritual in the right state, there is no limitations. The body has the capability to heal
Yes, for
itself.
healing.
It's just our job to try to get it in the right state.
In the right state. I say that all the time. You have the capability, if you have the knowledge, of course, of what's affecting your healing power. But this is incredible the way you
Yeah.
treat. Now, I want to share some stories because people love stories and they
Yeah.
learn so much of different treatments that you've done and what you've seen for their health moving forward.
Yeah, so I mean, a couple of things. It's kind of funny why certain story or certain patients and their stories stick with you. And so, a couple that come to my mind was I had a patient that came in, and it was a local patient, and she came in. She had heard from a friend of a friend of a friend that you should go see Dr. Porter, and so she came in and we went through the records appointment, and then we saw her at her consultation, and I showed her that she had an abscess around a root canal treated tooth, and of course it was not bothering her, which is very normal. That would certainly be the norm there, and so I showed it to her on the three-dimensional X-ray, and she said, "Yeah, okay, I have that." And so I explained to her of like what her treatment options were. I explained to her what conventional dentistry would recommend doing would be having the root canal redone again. That's what they would recommend. Other options that I would be more inclined from a health perspective to do would be to remove the tooth, clean everything out, have an implant, a ceramic implant placed. And so she said, "Okay, yeah, I'll do that. I think I can see the infection. I see there's a problem. Let's go ahead and do that." So we do that. We remove it and place our implant and do all that. And then she comes back to me, for a post-op check. And she's, "Oh, well, do you have a moment to talk?" And I said, "Yeah, yeah. What's on your mind?" And she said, and this lady, she weighs probably like 110 pounds soaking wet, very fit, healthy, seems to be. And there was all this information that she did not share with me previously. And she's, "Oh, I just wanted to let you know that, I've been suffering from severe GI issues for well over a decade." She's all, "I've been to the Cleveland Clinic. I've been to the Mayo Clinic. I've tried every diet known to man, the keto, the carnivore, the paleo, everything. And nobody can come up with a reason of why this problem has occurred." And I know that you told me that this tooth sits on the meridian of the digestive system, and I know that you said that, but every doctor thinks that what they do is the most important thing on the planet Earth. And I thought you were just one of those doctors. No offense. And I'm like, "Oh, no offense taken." She's all, "Within a week of that tooth being removed, I had zero digestive issues. They are all gone. I am cured." She's all, "I would have paid you the amount of money that I gave you for the removal of the tooth, the cleaning of it, using the ozone, using the laser, using all these the sonic instrument, placing the ceramic implant in, and placing the crown on. I would have just given you the money if you would have taken away my GI problems, even if I didn't have a tooth." She's all, "I just wanted to thank you, and I appreciate everything that you do, and all this." And then her mom actually came in and saw me about 4 months after that, and she's all, "I just wanted to thank you for what you did for my daughter. For the first time in probably 15 or 20 years, she's actually put on a healthy amount of weight."
Wow.
And
Wow.
so, that is just always kind of stuck with me. You think, Mayo Clinic, Cleveland Clinic. I mean, some of the brightest people in the world really are at these clinics, and for whatever reason, they don't get it yet, and that's unfortunate.
Mhm.
I
I hear
hope.
that all the time. I saw the top specialist and I was given
Yes.
no hope. And I tell my friend, I said, I never believe in no hope.
Yes.
We just got to keep
Yes.
asking, right?
Yeah.
But
Yeah.
I love that story. And it just proves that, yes, each tooth is connected to an organ. And how many, do you have any examples like, heart attacks? I know, cardiac disease from root canals, but it's never correlated. If they went to the emergency room and they're young, they're very active, and all of a sudden,
Yeah.
oh, a cardiac arrest.
Yes.
Often, can you mention, do you have any examples of that? Do you see that in your
Yeah.
practice?
I had a lady a lady that she's having constant like heart palpitations for years, and they were considering doing surgical intervention to try to control these. And so she had cavitations present, and if we talk about again the meridians on where those cavitations are, lower cavitations, they are set right on the heart meridian. And of course, I go into, with every patient, I try to give them realistic expectations. I explain to them, like, I cannot certainly promise you anything by, if you do this, this is going to happen. I can give you a definitive answer of, like, I believe 100% you are going to be healthier afterwards, but I can't definitively tell you that A is going to equal B 100% of the time. So anyway, she was aware of that. We looked at the X-rays and saw what the problem was, and she agreed. And she said, "Well, I need to get this taken care of regardless." Anyway, basically, after we get the cavitations cleaned out and everything, she's never had a heart issue since.
Wow. Because
So
cavitations are generally because of removed wisdom teeth.
yes,
And so a lot of people don't even know. Like you said, you won't have really pain or anything that will make you think, oh, maybe it's in my jaw or from the
right.
wisdom teeth I took out when I was 20.
Dental infections rarely ever equate to pain unless they go beyond what the immune system can kind of tolerate or handle. They'll rarely ever be associated with pain. Periodontal disease, there's rarely ever pain associated with that. A root canal treated tooth, there is no pain. The nerve has been killed in the tooth, so there's rarely ever pain there. I mean, I've had patients come in that basically told, well, my neurosurgeon said I had a tumor, and we found out that, we took a 3D and it was actually an abscess on a root canal treated tooth. I've had women, one that comes to my mind, where they'd been trying to get pregnant for over 5 years. They had a
Mm.
family already, a family of three, and they had been trying for the last 5 years to get pregnant, and they were doing everything, and they could not get pregnant. Well, she had a root canal treated tooth on number 9. Again, same kind of song and dance as far as, well, here's a root canal treated tooth. You have an abscess around there. These are your options. What would you like to do? I don't want this in my body. Let's get this infection out. We remove the tooth, clean everything out, place a ceramic implant in. She's pregnant within 2 weeks.
Wow. Wow. I've
Yeah.
heard that now
Yeah.
on and on and on again. And actually, I do also have a friend that was having problems getting pregnant and realized the last place she checked was the mouth, and she has
Yeah.
cavitation. So it'll be
Yeah.
interesting after the surgery, where her body will be, because she was doing everything else.
Yeah.
And I always say, for parents, if you are planning to have kids, to detox together beforehand
Yeah.
and prep your body, because it's epigenetic. A lot of these toxins will be epigenetic. I saw this
Yes.
with my own children, with dad having high mercury. I
Oh,
found
yes.
mercury in my children, and I was like, well, how? And so I learned that it's epigenetic. So doing these heavy metal cleanse, parasites, nutritional changes for your own gut health, and removing anything that might be infected. Like you
Yeah.
said, it's being educated, because your body's constantly fighting something. So if it's taking away, from healing anywhere else, or spending time in rejuvenating cells, because it's
Right.
always taking the time to,
Yes. Yeah.
this infection. So being aware as to
Yeah.
is so important.
Yeah.
And what I know you mentioned too, like, you say breast cancer as well, that you've noticed that oftentimes, but not all. I know I've mentioned this before to people, and they're like, "Well, I don't have an infection in the mouth," but also, well, do you have a root canal? Do you have cavitations? You might not have looked at
Yeah.
that either, because it's not. Um, common knowledge for most general dentists to look for those.
Right. Yeah. I think Dr. Levy, um, he's a cardiologist. I think in his book, I think he stated that 97% of women who have breast cancer have a root canal on the same side.
Wow.
So that, again, that doesn't mean that that's what's going to happen, but that's a pretty high number. And I think that he did a study to where they extracted 5,000 root canal treated teeth. 5,000 out of 5,000 of them came back infected.
Mhm.
So again, if it's a dead piece of tissue inside the body, there isn't a way to sterilize that. If your finger was black, there's not a healthcare practitioner on planet Earth, allopathic or naturopathic, that would encourage you to keep that finger. They would tell you to remove it because it's going to impact the rest of your body. And so dentistry has just not gotten there yet. Of like, we can't kill teeth and expect that not to have a biologic response on the body. Now, if we can agree that it's going to have a biologic response on the body, then we can have, I think, a discussion of like, is it best to keep it or not keep it? And some people may choose to keep it. And again, that's fine. My job is not to convince anybody of anything, but I think that we have to come to the agreement that it's going to have an effect on the body, and for different people, it's going to have a different effect. And so, all these things, again, we've been taught in medicine of like dentists, stay in this lane, your ENT stays in this lane, your heart doctor stays in this lane, and we fail to realize that all of it is combined. Everything works synergistically. Everything affects everything else. And so I think the outstanding physicians, one, understand that and are continuing to try to understand more about how it's affecting other parts of the body, or things, like I was at a chiropractic conference, oh shoot, I think a couple months ago in Washington, because I have an interest in learning again what I don't know. And I know there's a lot out there that I don't know. And so I probably spend half of my time either at medical conferences or chiropractic conferences or conferences outside of dentistry, because I want to gain more knowledge and insight. So for the things that I can help with, and also to be able to collaborate with healthcare practitioners that I can send patients to that have that same understanding.
And that's the key right there, is to find a practitioner that communicates because
Yeah.
with other practitioners, and that's how it should
Yeah.
be, because yeah, you got to communicate together because it's all intertwined. And I do the same thing. I don't just go to dental conferences. I go to biohack health conferences
Yes.
because the gut, the mouth is all connected, and I want to
Yes.
learn more just like you. And
Yeah.
chiropractic, cranial sacral,
Yes.
the even how the babies are coming out, the birth trauma, how that might
Yes.
affect,
Yes.
the nervous system and the tongue ties. And so it's
Yes.
all connected. So
It
I've
is.
done the same. And I use my podcast to also have experts on that talk about different fields because it's all interconnected.
You're exactly right.
Um, and I think a lot more physicians should communicate now with biological dentists and start understanding. And I love your friend that sends people to see, a practitioner like you, a dentist like you first,
Yeah.
because they get to roadblocks so often, and let's start in the mouth first. And I'm a true believer of that as well.
Yeah, they understand. Again, we all have to. No, nobody knows everything. All of us are learning. All of us are practicing. All of us, you hope, are just seeking again for truth. And so people are at different levels. And so you want as much collaboration as possible.
Yeah.
Ideally, yeah.
How can we get this more standardized though? I think it's such a, I feel now, I've been blessed enough to meet a lot of biological dentists, but still it's almost like only one per state that I would
Yeah.
actually recommend someone. So how can we really just allow other physicians to not feel that block, like that overwhelm to make that step, or to see their truth themselves without having, like, most of the dentists I talked to that made the switch is because they got really ill and
Oh,
had no
yes.
choice, got
Yeah.
really ill, or a family member did and they couldn't unsee the truth for yourself.
Yes.
It was pretty much from the beginning you were a truth seeker.
Yeah.
And So I would love for other practitioner to just start learning more and be
Yeah.
open to it. And I loved how you did explain though. You said maybe this is why so many, well, first of all, as humans, we're so resistant to change.
Yes.
But you said that imagine the doctors now spend $500,000 for school,
Yep.
and then you're out practicing, and then you learn that what you've been taught might have not been the best care. And so now
Yeah.
that's almost like an ego identity issue
Yes. Yeah.
that
I think it
yeah.
really in the end comes down to that is
Mhm.
you have to you have to s- you have to see the truth for the truth. And when you find the truth, one, you have to be open enough to just see it. And I think a
Mhm.
lot of people, because of ego, I explained to that in my book. One of my mentors, when he discovered the truth, he was so excited, and he went to his dental school mentor.
That was for orthodontics, right?
Yes,
He was an
yes.
ortho. Okay.
And his friend and colleague that they have been very close for 20 years, turned around and walked the other way and never spoke to him again.
Wow.
And
And I'd love
so
to shine that truth. Actually, I've never really dove into orthodontics. Ortho is to why this might not be the perfect smile, the first step for you to look into because it can actually affect your airway.
absolutely. So yeah, orthodontics, that's something I'm really passionate about, or my belief is in just facial growth and development. And so we see this trend that's happening at a rate that evolution really couldn't predict, of our faces and our airways getting smaller. Sleep apnea is at epidemic levels in certainly westernized countries, and it's because our faces have continued to get smaller and develop. Well, orthodontics is unfortunately thrown fuel on the fire. So the goal in orthodontics has just really been straight teeth. And certainly there's value in having straight teeth. Everybody wants straight teeth, including me. I
Yeah,
understand that.
me
And
too.
there's nothing wrong with that at all. But that's really been the focus of orthodontics, is just making sure that the teeth are straight. And whatever we have to do to get the teeth straight, we're going to do. Whether that means we're going to remove teeth, that's still practiced today. It's certainly, I think, done less today than it was in times past, but it is still done today. And so when they remove teeth, when they pull the teeth out, they end up pulling teeth back. And when you pull teeth back, now you have less room in your mouth for your tongue. So your tongue, if you're going to maintain lip seal, meaning your lips being together, the tongue is going to go further back into the throat. Okay. Or you're going to compensate on the other end of things, and your tongue is going to come forward, and you're going to hang your mouth open all day long, which that's going to have a snowball effect on your health as well too. As soon as we start exhaling through our mouth, breathing through our mouth, we automatically exhale too much CO2. CO2 is a smooth muscle relaxant. So as soon as you start breathing through your mouth, your lungs are going to constrict and your blood vessels are going to constrict. Okay. So the amount of oxygen that you're going to be able to absorb through your lungs is exponentially decreased. So from a health side of things, this is exactly the wrong thing to do. We want to maintain lip seal, breathe through our nose so our lungs expand, blood vessels dilate. Back before they had inhalers and an asthmatic was having an asthma attack, what did they used to have them do? They used to have them breathe into a brown paper bag, right? Because what they would be doing is breathing back in their own CO2. So they would do that. So they would breathe in their own CO2. If you breathe in the appropriate amount of CO2, your lungs will automatically start to expand. The amount of oxygen you can absorb is going to be exponentially increased. So we want to encourage forward growth in the face, a natural forward growth in the face. So one, we look more attractive because we do when our face develops more forward. And we have a broader, nicer, prettier smile. Again, all attractive features. But even more important than that is health. And so we don't want to be mouth breathers. We don't want to have things pulled back. And traditional orthodontics, if you think about it, there's a wire that sits on the outside of our teeth. Okay. We're connecting molars that have got three roots to incisors that have got single roots. When you connect a three-rooted tooth to an incisor that has got single roots, orthodontics is essentially kind of a game of tug of war. You're using one tooth to move another tooth, right? You're using something more stable to move something less stable, essentially. So do we think that the third molar or the first molar that's got three roots on there is going to have a greater impact than an incisor that's got single? Well, the answer is yes. So oftentimes what we see, and this you can simply measure this, right? This was what was proposed to my mentor, Dr. Hang, by somebody, Dr. Mew in England. He's all you have to do is just measure the cosmetic line of a patient. Do this on your patients. Measure from the tip of the nose to the incisal edge of the tooth, and you're going to get a measurement. That's called the cosmetic line measurement. That measurement, let's say for a 10-year-old boy, right, should be 33 millimeters, right, for ideal growth and development. Okay. So the age plus 23 millimeters. For a girl, the age plus 21 millimeters. Okay. For ideal facial growth and development. So you can measure this and do your orthodontics, however you think is the best way to do it, and measure that on your patients every visit and see if that starts getting longer or if it starts getting shorter. And Bill did this, and Bill noticed that the way he was doing it, it would get longer in every single patient.
Hmm.
And then when I started learning from Bill, I'm like, well, that's interesting, but this is something that I can go test in my own office. So I started doing the same thing, and I noticed the exact same thing. So traditional orthodontics has a tendency to pull teeth back. Yes, it does align and straighten them, but it pulls it back, which from a health standpoint is the last thing that we want to do. We want to do the exact opposite. And there are things that we can do to develop things laterally and forward without pulling things back. And so that's where really my passion and growth and development of the face and the airway have really stemmed from. And I have seen remarkable health improvements in patients, from asthma to a patient that was diagnosed with epilepsy, would have seizures in the middle of the night when they were sleeping. And then through kind of expansion, again, not just laterally, that's become pretty common in a lot of orthodontic treatment, is to expand. I would say that they're not expanding enough, but we could debate on that. But you can't really expand your way outside or out of an airway problem. You have to get forward growth and development. So the last thing that we want to do is to pull teeth back. Under no circumstances do we ever want to do that. And when you put on Herbst appliances or twin block appliances, so a Herbst appliance, essentially, if you have your upper incisors here and your lower incisors here, they'll tell you that a Herbst appliance is going to move the lower jaw forward like this. And in a perfect world, if it could do that, it would be fantastic. I would be all on board. But because the Herbst appliance cannot defy the laws of physics, you're attaching the lower jaw to the upper jaw through a piston mechanism. For every force you're pushing the lower jaw forward, you're pulling the upper jaw back. So instead of getting this, you're getting this. And sometimes you're getting this. So it's very unpredictable, but you're always going to have some force moving backwards. And so again, if you measure that cosmetic line on those kids that are in those appliances, because I've done it, you'll see that there's a retraction of the upper jaw. Yes, it does decrease the overbite, for sure. It does do that, but you're pulling back the upper jaw to accomplish that. And from a health standpoint, I would say that's not worth it. And so
Yeah, you don't want to affect the airway. Airway should
that's
never
right.
be number one you look at. Yes.
Number one, yes, above everything
Yeah.
else. Your body, again, I think I read somewhere that of like some things that somebody can like look for in an adolescent or in child or even in an adult to diagnose airway problems. The first thing is in a primary dentition with baby teeth is if all their baby teeth are touching in the front. If all the baby teeth are touching in the front, we know that they are compensating. Their breathing is compensated. You should have space in between all those teeth. In a permanent dentition for an adult, you want to look at wear on the teeth. Are the teeth flat? Do they have shape on the teeth, or are all the teeth flat? I look at the lowers first, and then I look at the uppers, because the teeth generally for most people set like this, again, upper teeth, bottom teeth. And if we're not breathing very well at night, the body's, again, primary responsibility is to, above everything else, is to breathe. If the airway collapses at night, the jaw is going to want to get pushed forward, because when the jaw moves forward, okay, the airway expands and opens up. So your body's going to destroy your teeth in an effort to breathe, and it will make that trade-off every single day. So if you're doing this over and over again, every single night, year after year after year, the first area you're going to start seeing it is on those lower incisors.
On the
And
lower.
what I've noticed over time is we're seeing wear at an earlier and earlier
Yes,
age.
I see that
Yes.
in young kids, younger and
Yes.
younger. Yes, I see that so often. And I'm like,
Yes.
oh, I try and, pitch as much as I can for parents to check for error with their kids when they're
Yes.
snoring and the wear and tear, like down to almost little chiclets,
Yes. Yes.
that's it. And I'm like, oh no, like let's look at the airway now.
Yes.
I love how you explained everything, because it's just simplifies it. You have
Yes.
the stories, get knowledgeable. And I feel like I talked to you for a really long time, but I am going to put a link for your book,
Oh,
AIME,
thank
first of
you.
all, because I do believe everybody listening, read it, then pass it on to family
Mm.
members, because the way you're treating, first of all, when you are treating someone and now they can live with vitality, it has a ripple effect to their family and for generations, because now they will know
Yeah.
to treat like this for generations to come. So
Yes.
we need a movement now to educate people. And your book is so simple. You're not a reader. This is a very easy read. And he makes it so easy to understand airway, infections, and metals. And advocate for your own health. This would be the biggest gift for you as a family. I absolutely loved it.
Well,
I'm
thank
going to
you.
be handing out copies everywhere I go. I'll bring it to work with me.
Well, thank you very much.
So thank you for writing it. And if people would like to come and get dental work with you, because you have a lot of people flying in, how can
Yeah.
they find you?
Well, we have two offices. We have one in Gillette, Wyoming, and then we have another location in Sturgis, South Dakota. I do work at each office. And so either by contacting our Gillette office, our website is www.mysynergydental.com. So it has all the information on there for the Gillette office and the Sturgis office. So we have people really fly in from across the country at each of those locations. And, certainly I would love to be a part of somebody's health journey and moving forward.
Yes, thank you. Yeah, that's
Yeah.
how we got aligned. Is I
Yeah.
had somehow Marissa found me and she connected with me because she wanted to share her dental story. So, and then she's like, "You got to
Yeah.
meet Dr. Porter." And thank
Well,
you for being a big supporter and being willing to take the time. I know you're a busy man, and I just honor what you do with such faith and doing God's work. It really, I do see that, and to bring this awareness to globally, that's my mission. Now this
yeah.
episode will be out there forever. And that's my
Yeah.
hope, is that it brings this education for a long life and give vitality to people. So thank you.
Well, thank you for what you're doing as well too. Like I said, spreading the word and informing and encouraging people in again a pathway forward. I believe it is.
Yes,
Yeah.
absolutely. Well, thank you very much for listening to Not Alone with Melissa Sue. If this resonated with you and you click like, okay, I need myself to advocate for myself. First step, read Dr. Porter's book, AIME. This will clarify so much. Then make the next step, find yourself a biological dentist, connect with Dr. Porter, and he can help you in your first step. I know it can become very overwhelming because you're like, oh, I've got root canal, I've got this. Just one step at a time. Read the book, get educated. Step 2, find a provider that is very knowledgeable into this. And I know my goal is to have a list state by state, actually globally. I just had a dentist from the UK,
Yeah.
and these are the resources you can go to, and I personally trust and have had on my podcast. So thank you again for listening. Please subscribe, share, so we can reach people globally.